This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Jeff Ratliff with the Neurology Podcast and Thomas Jefferson University. Today, I'm with Dara Albert from Nationwide Children's Hospital and Ohio State University. Dara is the senior author on a paper published in Neurology Education from the September of 2025 issue titled Education Research, Targeting Self-Described Knowledge Gaps to Improve Functional Neurologic Disorder Education Among Clinicians. Podcast listeners will remember I spoke with Dara and her co-author about an earlier paper back in April of 24 on the topic of education needs in child neurology residents in the realm of psychogenic non-epileptic seizures. So we have Dara back for a new paper talking more about her work and uncovering educational and understanding gaps when it comes to FND. So in this study, Dara and her colleagues conducted a qualitative analysis of questions submitted as part of a virtual online course about functional neurologic disorder, and in doing so, hope to learn again about gaps in understanding of FND, this time across a spectrum of healthcare professionals. Dara, welcome back.
Thank you so much. It's really a pleasure to be back and talk about one of my favorite topics, functional neurologic disorder, education.
Exactly. So we're blending FND, we're blending neurology education, and so if we just start with a take-home message. In doing this study, how would you summarize what you and your colleagues learned about your subject's knowledge gaps when it comes to FND?
So not terribly surprising that there are lots of knowledge gaps out there. FND, although it's a disorder that has been around for really millennia, it has been really poorly understood, poorly studied, and there's a lot that we have still to learn about FND or functional neurologic disorders. But the good news is in the last decade to 20 years, there's been a lot of new robust information and science that's coming out that's helping us learn more. And the rest of us need to catch up. So there's still a lot of folks out there who are not necessarily up to date on what our current knowledge on functional neurologic disorder is. And that's really a core mission of the Functional Neurologic Disorder Society. The creators of the educational course will talk a little bit more about it as we go through our conversation. But the big take-home message, I think, is that there's still a lot of knowledge gaps out there, and there's a lot of opportunities for all of us to learn more about this really interesting and millennia-old diagnosis.
We've talked about the evolution and changes and advancements in these mechanistic understandings of FND. And for many of us as clinicians, our understanding of FND is probably different than what it was during earlier portions of our career or during our training. Can we expand a little bit on that? What are some of your hypotheses and maybe some assumptions on these misunderstandings of functional neurologic disorder that are coming from this growth of understanding in FND that you were just talking about, or even just changes in the vocabulary and terminology we use in FND?
Yeah, we can't quite make up our minds on terminology, right? Yeah, you hit the nail right on the head that there really has been this explosion in understanding that the rest of us need to get caught up on. And even in my own experience, the way that patients with FND were approached during my training versus how I approach them now is pretty dramatically different. I would think probably the most important takeaway is that we really need to approach these patients with compassion, with curiosity, with understanding. And that is something that I didn't necessarily see in my training with every patient interaction that I was a part of or that I witnessed my professors engaging with patients. And some of that old thinking comes through in some of the responses that we got in our study. Folks were asking questions about what is the role of using seizure medications in functional seizures, which doesn't really make sense if you have a current understanding of what functional seizures are and how they're not epileptic seizures and they wouldn't respond to anti-seizure medication. We have questions from folks about how to discuss the diagnosis, how to explain it, that there's still misunderstanding in ourselves, that we as clinicians don't fully understand this diagnosis or how to explain it to patients and families in a way that's validating and supportive. And there's really a need for us to explain it better.
So coming into this study, you mentioned maybe some of those misunderstandings are about treatment, right? Should we use anti-seizure medicines for functional seizures? Are there other predicted or hypothesized misunderstandings that come from how our knowledge or understanding of FND has evolved as of late?
Two other big points to make is that there is still some beliefs out there that FND is fake, that patients are making up their symptoms or are intentionally causing their symptoms. And this is just simply not true. FND is different than malingering and or factitious disorder. Patients are very much experiencing their symptoms. They're not causing them to happen. And that's a big area of misunderstanding. And then another big area of misunderstanding that we're needing to shift in our thinking is that FND is no longer a diagnosis of exclusion. There shouldn't be this philosophy of we have to do all the tests, we have to do all the scans, all the workup, and then if everything is negative, then at the end of it, okay, you have FND. And this sort of leads us down this logical cul-de-sac or dead end, if you will, of maybe the doctor just isn't smart enough and they haven't done all the right tests. And I just need to go see another doctor who can do more tests on me to figure out what's wrong with me because they don't know what it is. And so there really needs to be this shift in thinking where we have positive rule-in signs for FND. We can make a diagnosis based on history, physical, and maybe a few diagnostic tests. If we have a differential, for example, I'm trying to differentiate between a stroke and functional neurologic disorder cause of weakness, I might get an MRI to exclude that stroke. But we can make a positive diagnosis and we can communicate that diagnosis from the beginning as opposed to going on this long diagnostic odyssey and at the end of it, everything's negative, so therefore you have FND. No, it's you have FND because X, Y, and Z. So this is another big area that we really need to shift our thinking and our management and our evaluation style.
And obviously, those types of misunderstandings are going to have implications on the diagnostic process in and of itself, both the tests that are ordered unnecessarily, as you said, or as you alluded to at the beginning, if people in the healthcare system are feeling that these symptoms are manufactured or being feigned, then the delivery of the diagnosis and the communication that we have at the time of recognition and diagnosis is obviously going to be off track. And so I think that's a good segue into an important point I was hoping you could talk about next, in that this online course that this data was generated from is not just physicians or not just neurologists and not even just physicians who are taking this course. And so can you expand a little bit more about the population of people that are generating the data that was analyzed in this study, so that when we're thinking about where are misconceptions and knowledge gaps in functional neurologic disorder, we can start to understand the pervasiveness of these gaps throughout our entire healthcare team and system?
Yes, definitely. Pervasiveness throughout the system is a good way to put it. So the Functional Neurologic Disorder Society, FNDS, the organization that created these virtual courses, they've created several. And this one in particular was geared towards clinicians. We wanted to make it really broad for any clinician who might encounter a patient with functional neurologic disorder, and really tried to design the course to touch on important themes that would be relevant across the healthcare system, including how to communicate with patients about their diagnosis. That is an important piece of all of this, as we've been talking about. The course was open to anybody who wanted to register. And what we found was that we had folks who were, of course, neurologists, but we also had psychiatrists, we had physical medicine and rehabilitation specialists, we had psychologists, occupational therapists, physical therapists, speech language pathologists, and then we had a few folks that labeled themselves as others, either other physician or otherwise. So definitely a slice through the healthcare system. Lots of different folks were interested in coming and learning more about FND, which is really encouraging.
So now that we understand that these gaps that you analyzed are coming from a real breadth of healthcare professionals, let's dive a little bit deeper into those results. And so just to try and summarize the methodology, if I can, but please correct me if I'm wrong, as part of this course, participants submitted questions as participants in the course. And what you and your colleagues did was qualitatively looked at the content of those questions and tried to put them into thematic buckets, so to speak, using a thematic qualitative analysis to figure out what are the themes of these gaps as reflected in the questions that course participants are submitting. And so can you tell us a little bit about the observations and the conclusions that you started to reach, and what are the types of themes that apply to these knowledge gap questions? And maybe, as you did in our earlier question, what are some examples of the types of questions that apply to each of those themes or buckets?
We managed to pull out 7 different themes that relate to the questions that people submitted. Just to add to what you said, part of the virtual course is most of it was asynchronous learning, but there was a live Q&A type of webinar. And rather than having folks just submit questions live, when they registered for the course, we asked them to submit questions ahead of time. And so that's where we got the questions for. And of course, we tried to answer as many of them as we could during the live webinar discussion. So the 7 themes that we pulled out were specific management questions. And here's where we had folks asking, for example, about what is the role for short-term benzodiazepine use in terminating longer functional seizures, and questions about what types of treatments should patients get with functional neurologic disorder. The second theme was communicating with patients. As we've already been talking about, communication has often been a challenge point in the diagnostic journey of FND. These folks that registered for the course also recognized that and asked, what are some ways that we can communicate with patients? This question nicely sums it up. What is the best way to explain the diagnosis to patients so it is validating and supportive? Thank you to whoever submitted that question, because that is a really important question. The next theme was communicating with other providers. So there's also a recognition that, some of us have drank the Kool-Aid and get the FND vibes and understand how to approach and communicate about these patients. However, there might be others in the healthcare system who are less engaged with this area or perhaps less informed. And so there were questions like, how do we teach our colleagues? How do we effectively provide education to others in the healthcare system about FND, including residents or trainees? How do we teach them about FND and how to help these patients? And then the next 2 themes were splitting the clinical milieu where the encounter is taking place. So the one theme is on outpatient challenges. So like, we make a diagnosis of FND. Where do we send our patients? We have many places in the country that there isn't ready access to a multidisciplinary team who's ready and willing to take care of these patients. And so we got lots of questions about, okay, I can make the diagnosis, but then where do I send these patients? And I imagine that lots of people have that challenge. One telling comment, which hits this theme really hard, is somebody says, patients with FND are often treated like hot potato. No one sees these patients falling within their mandate, which is sad to think about, but probably not too far from reality, that there aren't a lot of folks out there who are, please send me your FND patients. Let me see them. Hopefully we are growing and there continue to be more into the future. The other clinical venue where we're seeing patients is the inpatient and also the emergency department spaces. And so there were questions about that. Folks asked, what's the best way to triage these patients? Should we be making that diagnosis in the emergency room, or how do we approach it in the emergency room? Things like that. And then the last 2 were more around either the diagnostic uncertainty or misconceptions in pathology. So under diagnostic uncertainty, some folks asked about, what about patients who are seeking many second opinions? How do you navigate that? And then misconceptions of pathology. What are the patient experiences that might trigger? Or there were certainly questions about stress or anxiety or trauma or things like that come up that, yes, those pieces may be part of an individual's risk factors, but that's not necessarily the story of every patient with FND. Those are stemming from some misconceptions about what is the true cause, what is the underlying cause of FND.
Just to summarize, it sounds like, to go through those again, there's themes regarding treatment. How do we treat patients? There's themes regarding communication, both communicating with patients about FND and communicating with our colleagues about patients with FND. There are themes about the management and triage process in both the outpatient and the inpatient or emergency room space. And then there's the diagnostic uncertainty questions. What do I do about second opinions and things like that? And then finally, there's those misconceptions about the processes that lead to FND diagnosis or FND symptoms. And so now that we've learned about those themes, and you and I are both educators, and so we get to now think about the path forward. And so that's where these types of studies hopefully take us, is you've done an analysis, you're looking at what are the knowledge gaps that are out there. And so what can you or other educators who read this paper do with these results? How do we take these themes of these knowledge gaps that are out there in the healthcare community and then devise educational strategies and activities and curricula to improve the understanding of FND amongst those individuals?
Yeah, so when we're thinking about designing educational activity and educational intervention, one of the first steps that we often think about is what we like to refer to as a needs assessment, right? What are the needs? What are the learning needs? I hope that this paper demonstrates that there are lots of learning needs, that there are gaps in understanding and knowledge out there. And so there is a need for this type of education. So that's number one. This is a very common neurologic diagnosis encountered. Certainly when we speak about neurology education in particular, this diagnosis is encountered by all of us. Whether you're an inpatient neurologist, an outpatient neurologist, a child neurologist, an adult neurologist, you will see patients with FND probably frequently, perhaps more frequently than some of the other diagnoses that we spend a lot of educational time on. So that's really important to recognize that this should be part of neurology training, for example. This should be a topic that gets covered. And hopefully these themes that we came up with can serve as somewhat of a roadmap of what are the things that I should put. If I'm going to design a module, a lecture, a simulation encounter, something that's going to teach this topic, what are the things that I should be including? And these themes, hopefully, like I said, can serve as a roadmap. Here are the things that we need to think about. We need to think about how we make the diagnosis and how we communicate the diagnosis. The same would be true for psychiatrists or psychologists or other folks outside of neurology that also see FND patients. There's a recognition, number one, that this is a common disorder and that their trainees also should be learning something about FND. There's always that hidden curriculum agenda of what gets into the curriculum and what doesn't. And it speaks volumes sometimes when we're going through a neurology curriculum and FND is nowhere. That hidden message to our trainees is that this is a diagnosis that doesn't matter, right? That this is not important for us to talk about or to think about. You'll just figure it out. And that's just wrong. This diagnosis is common and it's important. And our patients with FND suffer greatly. They're very significant symptoms. So hopefully this paper, among others, demonstrates to folks that are interested in education to be teaching about this topic.
I think as teachers, it's both including the topic and including the topic in a way that hopefully starts to address these themes that you and your colleagues identified. And if we're going to build an activity to help people communicate the diagnosis, to help people understand the underlying pathophysiology of FND development, there's obviously some fodder here for teaching and interventions. And before we end, I also want to hear about the clinicians, right? And clinicians and educators, we both know it's not a mutually exclusive thing. And many of us wear both of those hats. And so now, as clinicians reading this study or listening to this podcast, based on these results, we know there are some themes that describe knowledge gaps, again, across not just physicians, but our colleagues who are taking care of patients with FND. And there are health team allies, there are physical therapists, occupational therapists, there are psychiatry colleagues, our physical medicine and rehab colleagues. And so some of this may come from those communication themes that you identified. But so as we look to enlist these other members of the team to help take care of our patients that we see with functional neurologic disorder, what can we do better as neurologists to help ensure our patients are getting optimized care for their FND?
It starts with approaching patients with curiosity and compassion. Just like any other diagnosis, there is power in listening to people's stories, to not dismissing them. And we take the time to listen to a careful semiology history in an epilepsy patient, right? We want to know what happens when they have their seizure before, during, and after. Approaching a patient with FND with that same level of curiosity, of taking a thorough history, of listening to their story and allowing them to share their story, and providing some empathy. That's really hard. What you're going through is really hard, and it's not in your head. And I understand what's going on. I know that you're not faking it. These things can be very validating and helpful to patients. And at the very least, we can stop doing harm with our words. I think that's really important. And FND, if you're a neurologist who hasn't really taken a look at the FND literature in a while, please do get yourself up to date, because there's a lot that we have learned over the past 10 to 20 years, like I said, about the mechanisms, about the pathophysiology, about what FND really is. And please know that it is a brain disorder. It is a brain disorder, and we are brain doctors as neurologists, right? And so this is a disorder that is in our sphere, and these are patients that we can help.
That's excellent. Go read this paper, and to do just that, to dive into this literature. I've been speaking with Dara Albert from Nationwide Children's Hospital at Ohio State University about her paper, which was published in Neurology Education. And the paper is titled Targeting Self-Described Knowledge Gaps to Improve Functional Neurologic Disorder Education Among Clinicians. You can find this article on the Green Journal website following the link to the journal Neurology Education. Dara, thanks for joining us.
Thank you so much for having me.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.